I'm Jill Lally, and I'd like to welcome you to the Natural Way to Better Health and Wellness. Dr. Donald DeFabio, chiropractic sports physician extraordinaire, is with us today to talk about preventing running injuries. Doctor, welcome and thank you for joining us.
Hey, thanks for having me here, Jill. I'm looking forward to a great show. It's always a pleasure to be here.
Thank you, Doctor. Well, you know, people have all kinds of reasons for running. Yeah. They run to stay in shape, they run to relieve stress, they run to just have fun, and they really run to stay healthy. But with all these running enthusiasts, they really do set themselves up for injury. And we're here to ask you really, how can we prevent running injuries?
There's a lot you can do to help prevent injuries. And that's the crux of my Run Better, Run More program, which is to teach people basically if you have better running mechanics and you can run more, and whatever your goal is, to train for a marathon, an Ironman, or just go out and relieve stress or to burn up a few extra calories. But it's all about improving running efficiency. And if you're more efficient with your running, you can train more and do more of whatever you want to do. So I look at it that way. So looking at it from a mechanical standpoint, and then beyond that, we break it down to simple things like warming up properly, cooling down properly, keeping your muscles healthy before and after workouts. Core stability is huge for injury prevention. And of course, nutrition, diet, and some people even need to work on balance and agility. But those are the factors at helping people run better so they can run more and avoid injuries.
So is there any one primary factor in what you've just said?
It depends on the individual.
Okay.
To be honest with you, and that's why we always start out with an assessment of our runners to figure out where their weaknesses are. Is it a flexibility issue? Is it a strength issue? Is it a core issue? But one thing that I do think is really, really important when it comes to improving running efficiency is to take something from another sport, from swimming. I like to use the analogy. Swimmers are very technically precise because it's not a very forgiving sport. If you have improper form and technique, you know, you're not going to swim real well. I mean, I can swim to save my life, but I can't do laps. I don't have good technique. So I like to focus in on that with all of my runners, and especially in my running clinic. And it starts with looking at what we call the kinetic chain. Running is a linear activity. It's supposed to propel yourself forward. So any energy that you use going left and right, up and down, or into the ground with hard slapping feet is lost energy. You should run like the wind. Be quiet, effortless, efficient, and straightforward. So I like to train people with all of my exercises: feet straight ahead, knees over the feet, hips level, shoulders level, head level, arms close to your body. First, you may have to train your body to move like a sprinter who's very efficient. Then you can translate that into a relaxed stride for recreational running or, hey, performance running. But let's face it, marathoners today, elite marathoners, are running 5-minute miles. That's a sprint. That's not going out for a casual jog at a 12-minute pace. You know, so it's a little bit of a difference. So to get back to your question, when it comes to training the kinetic chain, I always start with what's called the dynamic warm-up. And it's not just doing some dynamic stretches, which is important, and we'll hopefully can talk about stretching later, because it is not a warm-up. But a dynamic warm-up is designed to retrain your muscles to move in a linear pattern, yet to also stabilize the muscles that prevent you from going side to side, which is lost energy. So that's the one thing we really take some time to teach people.
So is the dynamic warm-up done in a sequence?
It's my sequence.
Oh,
it's the DeFabio sequence. Okay?
The DeFabio difference.
It's the DeFabio difference. It's something I put together and it makes sense to me. Okay. So, for example, I'll start with a series of what I call runner's marches to prime the pump. So, and I brought some videos, so I think they can place I'll talk about the exercises and they can show them. So okay. The first one would be runner's marches. And you can just see elbows are in tight, arms are going straight, knees are straight, feet are straight. I do about 15 on each side. After that, I like to transition to lunges. Everyday lunges that people do all the time, but very focused in on where's your foot landing, where's your foot recovering, where are your arms doing, what's your chest doing. Think about being efficient with your running. I'll do lunges to the front, I'll do lunges to the back, and then I'll also do side lunges, making sure the feet stay straight ahead and I don't collapse. Why? Because you got to keep those side muscles strong enough so you don't waddle and flap. Those are very important stabilizers. And then after that, I like to do some standing quarter squats just to help strengthen the thighs and the quadriceps. And we also do these little exercises called kickbacks, all right, to get the glute and the butt muscles very engaged. Your hamstrings work up to 90% of the time when you run. They're very undertrained. What's also undertrained is the hip and the butt. Very important to prevent injury. Very important to save the knee and foot. I can't emphasize that enough. And then after that, we do some integrative exercises. I call them cranes, where you do like a running motion, trying to stay on one foot, but it's not a balance test. If you need to do a little toe touch in the back for stability, that's fine. And then lastly, for butt and legs, I throw in prisoner squats. But you do that before you run as a warm-up, training your muscles how you want your body to move. Then once your body knows that, you go out and run. Then when you finish, you try to replicate those motions as you finish your run and your cool down. And that's what helps bring it all together to improve your mechanics.
Well, it sounds like a great integrative approach. Do you look at someone doing this dynamic warm-up as you're teaching them?
Yeah, when people do the dynamic warm-ups, they should be watching somebody. You know, that's what we do in the office. When we do our running clinics, we watch people to make sure they're putting their feet in the right place, their hands in the right place, the hips are in the right place. So yes, come to one of our running clinics, watch yourselves do it in the mirror, work with somebody to make sure you have good mechanics, because if you train yourself to do the exercises wrong, when you run, you're not going to get the results that you want, which is better mechanics. So that is an important point, Jill.
Well, that is an integrative approach. Thank you, Doctor. I'm Jill Lally, and we're with Dr. Donald DeFabio on the natural way to better health and wellness, and we'll be right back. Thank you.
Fixing plantar fasciitis forever. We talked about the exercises, but we didn't show them. So today we're going to show you the exercises that you need to know to fix plantar fasciitis forever. There's 3 regions you have to address: the bottom, the middle, and the top. Let's get started. Amanda, turn sideways for me, please. We need to look at the bottom first, which is the calves. They need to stretch and strengthen. To stretch the calves, you do basic runner stretches. Push the hips forward to stretch the gastrocnemius. Come on back, bend the knee, drive forward. Keeping that knee bent will get the lower, the soleus. You must do both stretches for the calves, but they're still not strong. They're weak and tight. So to strengthen the calves, step up on the stool for me, please, Amanda. We do eccentric calves. Go up on your toes, hold 1, 2, slowly go down 3, 4. Eccentric release, lengthens and strengthens at the same time. Go up on your toes, hold 1, 2, slowly go down 2, 3, 4. That's going to lengthen and strengthen the calves. However, you also need to strengthen the middle region, the glutes, the butt. The gluteus medius muscles are essential to strengthen to fix plantar fasciitis forever. I like glute medius proprio kicks. Amanda, well done. She's got her exercise band on. Now she's going to show you. You hold on. It's not a balance test. And little proprio kicks, we call them. 45-degree angle back, not straight to the side, not straight to the back. Isolating the gluteus medius, essential to fix plantar fasciitis forever. However, if we follow the kinetic chain, the fascial chain of the plantar fascia, it goes all the way to the neck. So we also have to address the neck. The deep cervical flexors are the next muscle group that we need to address. And that's dropping the chin down. Dropping the chin down. She's standing. Gravity's pushing her head forward, so she's not doing any work. But I want you to see the chin has to go down. So with a stretch band, drop your chin down to your chest and come on back. Drop your chin down to your chest and come on back. Drop the chin down to your chest. I love doing this one lying down, actually, because you're fighting gravity. Those are the exercises you need to know to fix plantar fasciitis forever, from the bottom to the middle all the way to the top, to the neck. How much? 3 sets of 15 to 20 once a day, then progress to twice a day, then progress to 3 times a day. You can get more aggressive with all of those, but stretch and strengthen the calves, stabilize the hips and the glute medius, and strengthen those deep cervical flexors. That's the DeFabio difference. I'm Dr. Donald DeFabio.
Thank you, doctor. That was a wonderful demonstration. You mentioned about the uneven hips and the legs and the foot placement and the knees. Could you please expand that discussion?
Yeah, no, I did gloss over that when we talked about the dynamic warm-up a few times. But what we have to understand is, yes, running is a linear activity. Everything it does, it pushes us forward, which is great. The problem is when you run a lot and cycle a lot, all of the muscles that propel you forward get stronger and stronger and stronger. And the muscles that stabilize your hips and back, that allow you to do that, don't get as strong. They become relatively weak. Specifically, your gluteus medius and maximus, your hip, your butt muscles, major stabilizers, major power transfers for the body. Now, I'm going to date myself, but there was an actor, Walter Brennan, that used to walk with the hip dropping, all right? That's a weakness in the gluteus medius muscle. When that muscle gets weak, not only do the hips drop and a wasted energy for a runner, it causes the knee on that side to turn in. And then it causes the foot to turn out. What happens is it creates knee pain as well as hip pain. So it's a real problem if those muscles get weak. So you have your dynamic warm-up. On top of that, number 2, to keep you healthy and prevent injuries, is going to be core stability and strengthening of those gluteus medius muscles. That's going to be the second avenue of approach to help reduce the risk for a majority of lower extremity injuries in runners.
Well, I know you have mentioned quad dominance, that we think of our quadricep, the front muscles, and now it's creating that awareness of strengthening the back muscles, the buttock and the hamstring, and you do that for your runners in this core stability?
Yeah, well, I incorporate the two. Because technically your gluteus medius and gluteus maximus and even hamstrings, if they're weak, aren't core muscles. Your core muscles are considered around your deep abdominal area.
Okay.
They do go from your pelvic floor. Your core muscles do go all the way up into your neck. But they're the small, tiny stabilizer muscles along the spine. Your diaphragm's a core stabilizer, as well as the deep muscles around your midsection. They all have to be strong. Because for anybody, especially athletes, but for anybody, because it's a junction box of energy transfer. If you're loosey-goosey in here, when you try to move and shift directions, you're going to lose all your energy and you're not going to be efficient. And it's going to create a lot of lower back problems. That's why people talk about strengthening the core for prevent lower back injury. So we incorporate the two together because I like being efficient. So my core stability program for runners actually incorporates hip and glute strengthening as well.
That's an excellent description, a junction box of energy transfer. And that's such a great visual, so you can really understand and create that awareness for the runner.
Yeah, because, thank you. If you don't have a good energy transfer on all sports, that's where you're going to break down. And that's why I see my athletes in the office with back pain because of that, to be honest with you. So these are just great exercises.
And you mentioned breathing and the diaphragm. Will that help runners in their endurance and breathing more efficiently and effectively?
Of course it will. Breathing technique and teaching breathing techniques is really a whole other animal.
Okay.
What I will say about that is deep abdominal breathing is the way to go to train yourself to open up your rib cage like a bellows from the bottom and not to breathe from up in here. Some people can do it easily. Some people have a hard time doing it. If you're a singer, they do it all the time, all right? But yeah, breathing is essential, But it's the fact that what people also need to know about core stability is your rectus abdominis, your six-pack muscle, is not considered a core stabilizer. That's a power muscle that generates power. The ones we want to get to are underneath it, and those are the ones that are really important.
It's a lot of information, and it's exciting to see that you really take the time to explain to your runners and your athletes and your patient all the difference and the nuances to this.
You know, Jill, it's sometimes you have to break people down in their exercise programs with very simple movement patterns to get to the muscles that aren't strong enough to then build them back up to where they want to be. So I do that with my injured population, my injured athletes. It makes sense that if you're not injured, well, let's get you started on some of those same exercises. It's just like cardiac rehab. You get a heart attack. What do? They send you to cardiac, and you survive. You go to cardiac rehab. You get on the treadmill for 30 minutes 3 times a week. So let's get you on the treadmill 3 times a week before your heart attack, and maybe you won't get one, and if you get one, maybe you'll respond quicker. Right. It's the same concept. You just got to make sure you're doing the right exercises with the right technique.
Thank you, doctor. And when we come back, would you please talk to us about stretching versus strengthening and maybe even some hydration?
I can do that.
Thank you. I'm Jill Lally, and you're watching The Natural Way to Better Health and Wellness with Dr. Donald DeFabio.
Sports are essential for our youth today. In fact, consider this. Sports is the only part of the education process where it's positive reinforcement.
My son Liam's a basketball player, and he injured his knee last January. And Dr. DeFabio was recommended by the folks over at Gabriel Fitness.
As a gym owner, there's lots of people that need to be part of your team that you need to have relationships with to help keep your clients as healthy as possible.
One of the most common injuries we see with youth athletes is the sprained ankle or rolled ankle, and we get excellent results. I have a very unique protocol for that. We start treating them day one with, it's called Graston, but it's an instrument-assisted massage. Get the inflammation out, a special type of taping to stabilize it that doesn't restrict movement, adjustments on the foot if needed, and then exercises as soon as we can. And that gets kids back really, really quick.
Liam, he had a damage to his knee. Dr. DeFabio helped him pinpoint his issues, his form, and strengthen him, and basically give him the treatment that he needed to get better and start playing again.
The next common injury we see would probably be shoulder problems.
I woke up in the middle of the night and I was unable to lift my shoulder at all. It's important that I have both of my shoulders because I'm so dependent on them.
Balancing the muscles of the shoulder, but looking at the elbow, looking at the neck, looking at the upper back, because the shoulder girdle sits on the rib cage and it's all tied together. So you have to balance that whole area to get it working well.
When I'm here and I observe some of the treatments that Dr. DeFabio gives to my son, they're informative, and I think they're things that any athlete can use to prevent injuries and to stay in shape.
Whereas I think a lot of doctors, they just treat you when you come in, they send you on your way, and you're just coming back week after week. But the education, I think, is really important because it helps people understand why they're here.
Usually when you're here, it's because of something negative. You're not here, for anything other than trying to get better from something that was negative. And if there's a place to be, it would be here.
And as athletes start getting to a higher level, everyone's kind of on the same playing field, and what's going to give them that edge? And that's being able to stay healthy all the time. And Dr. DeFabio, I've seen firsthand, has been able to do that.
The great thing about using sports medicine for everybody is, what does an athlete want? They want to get better quickly. They want to stay in the game. That's what I bring to the table with all of my patients. Rapid results and staying in the game. What can you do versus what you can't do? Did you know that chiropractic care can help posterior tibial tendonitis? That's a type of shin splints, and we're going to demonstrate how we manage that here in the office. Michael's here with us now, and he's a marathon runner, been running most of his adult life, over 10 marathons, and recently he found he was getting a little bit of calf pain during his marathon. It was a real hot day, and he was trying to stay hydrated, been doing all of his trainings, but he figured, it's a little sore, I'll continue to run through it. Well, he finished the race, and the calf stayed sore. lightened up on his running for a few weeks, and his calf stayed sore. He found ballistic activities, jumping, pushing off was really painful. And at that point it got to, well, I need to do something. So he came in. And we examined him, we gave him a thorough examination, and we found that it was one specific calf muscle which had tightened up and had knotted, become a little bit of fibrotic, some tightness in there. And it turned out to be his posterior tibial muscle. And we have a little heat on his calf now because that's the first step in treating it. But the posterior tibial muscle just runs right back behind the shin. A lot of people would call it like a posterior shin splint. But in this case, it was a strained muscle that had become stiff and tight. So we came up with an accurate diagnosis, pinpointed his problem. We muscle tested it. It gave him pain. So we knew that was the issue. So how do we treat this? Well, first we put a little heat on it to relax it. Then we put some skin lubricant over the area, and we're going to use a procedure called Grafton, where we take a stainless steel tool and we loosen up the tightness in the scar tissue. So a little lubricant over the skin, and we use the stainless steel tools just to break down those pockets of scar tissue. In the calf, there's lots of different muscles that are involved, but we want to screen the whole area. We're going to really hit this inside part. And as Michael's been doing better, we've also found he had some tightness through here, which has been residual. Treatment time is really not that long. We can use a broader base stroke just to get the blood circulating. Now, if you notice, he's getting a little redder than it was a moment ago. That's because the Grafton does create redness. When we get in there really deep, it'll also sometimes create little pockets of bruising. This is the first stage with the Grafton. The next way we'll do it with the Grafton is we'll have him weight bearing and loading the muscle while we're doing it. That helps to break down some of the even deeper scar tissue. Now we're going to get in with a different instrument right up and through here. That's the muscle itself. And beyond that, we even do functional movement patterns sometimes, where we put the athlete or patient right through their specific movement patterns while we're doing the Grafton. The bottom line is we need to break down the scar tissue between the individual muscles, as well as the scar tissue within the muscle fibers of the belly of the muscle itself. Drives blood to the area, loosens up the scar tissue, restores flexibility. Then we can turn around and rehab it properly. Then we had Michael doing some corrective exercises for the posterior tibial muscle specifically, and we get him back running. It's a very effective way of treating it. We're going to give you just a few more minutes of Grafton, then we're going to demonstrate weight bearing and his posterior tibial exercises, and then you'll know that chiropractic care works really well for posterior tibial tendonitis. So with this approach, we're actually loading the soleus and posterior tibial muscles nicely while we're doing the Grafton. Very aggressive, but very, very effective. When there's inflammation, we generally don't do this. This is in the subacute phase of treatment. And then it gives us the ability to really get to those deeper muscles in a functional movement pattern. Posterior tibial muscle runs back through here and underneath the bottom of the arch. So to strengthen that, you can go up onto your toes, but then you also want to kick the heels in just a little bit, derotate the heels, and drop down. Bring up onto your toes, weight on the big toe, curl in, straighten, and go down. That works the posterior tibial muscle, clearance of the hamstrings into the butt. Great way to strengthen them. Real slow on the way down. Start with 2 feet like this, then we progress to doing them off the stair, then we progress to doing just 1 foot at a time. So that's the integrated approach for treating posterior tibial tendonitis in the runner with chiropractic care. Of course, we're adjusting his lower back, hip, and knee to make sure his mechanics are good. With Grafton therapy, corrective exercises. Now you know posterior tibial tendonitis responds great to the procedures we use in the office. I'm Dr. Donald DeFabio.
Thanks for joining us. I'm Jill Lally on The Natural Way to Better Health and Wellness with Dr. Donald DeFabio. And doctor, you mentioned that stretching is really not a warm-up for runners. Could you explain that to us, please?
Yeah, well, Jill, stretching is not a warm-up for anybody. The current research is very well established that static stretching the old bend and hold, stretch and hold, does not warm up your muscles and in fact will decrease athletic performance. Only in certain populations where flexibility is very important, perhaps in a gymnast, is it important before athletic activity. In fact, stretching will actually decrease athletic performance. So it's not a warm-up. Now that doesn't mean that stretching's not good. There is a place for static stretching, okay? However, it's not a warm-up.
Okay, so
Therefore, what I tell my patients is the reality of it, stretching is great to lengthen the muscles,
Okay.
to loosen the muscles, to create flexibility. And there's other ways to do it too, but it's best done when the muscles are warm. All right?
Okay.
I do have some runners that'll start their warm-up, do their dynamic warm-up, go for a little jog, stop and stretch. That's okay. I have some people that have chronic issues. They run a little bit, they start to tighten up, they stop and stretch. That's okay. That's where you want to use the stretching, where the muscles are tight, but they're warm, and you want to lengthen them. I love to use stretching as part of my cool down, okay? After I've exercised, the muscles are warm, they're pliable, they're like taffy. Think of your muscles like taffy. When it's warm and pliable, then you let it cool, that's what it's going to remember.
okay.
All right? So if you let it cool in a tight position, that's what it's going to remember. If the last few strides you did was with very poor mechanics, poor technique, right? Your feet were turned out, and your arms are going across your body, and your hips are going back and forth, that's what they're going to remember. But if you start with the dynamic warm-up, you run, then you finish your run with some walking or cool-down exercise or stretches, reinforcing what you told it in the dynamic warm-up, over time, you will repattern your running mechanics, which will make you more efficient, which means you can run better and run more.
That's fantastic, doctor. You know, if our viewers would like to contact you about this information, how may they do that?
My office is in Berkeley Heights. They can call me directly at 908-771-0220. I had to remember that. Or my website is fine. They can go right through my website. In fact, I have a section on my website for runners only. A lot of great information. That's DeFabio chiropractic.com. That's my website. And I'm all over YouTube. I got a lot of my exercises and a lot of my videos on how to prevent injuries and treat injuries on my YouTube channel, just Dr. DeFabio on YouTube. So I'm kind of all out there.
Thank you, doctor.
You're welcome.
We really appreciate the information. I asked you about hydration and water.
There you go. Well, you know, Jill, hydration is an everyday thing. It is not a race day thing. It is not I'm going for a run thing. When I do my running clinics, we usually go out for about a half-hour run. If you're properly hydrated, you don't need to bring any water or hydration with you for a half-hour workout, all right? Which means proper hydration is you're peeing regularly and your pee is not real dark. The Boy Scouts use the term, it should be more like pineapple juice and less like apple juice, the color of your pee. Just a light yellow, not real dark, okay? If you have a half-hour to 35-minute workout, cardiovascular workout, and you're properly hydrated, you don't need anything. After about a half-hour to 40 minutes, yes, you have to begin to hydrate with something. Start with water. If your workout goes longer than about 15 minutes or so, you definitely have to add some sort of nutrient source to your water. Carbohydrates usually are the best. A sports drink with a long-chain glucose polymer in it, that's the best thing. Maltodextrin is really great, or a long-chain sugar as opposed to sucrose or dextrose or fructose, like a simple sugar. So you got to read the label of your sports drink. Or an Energy Chew or something like that if you're going past that 50-minute time. And then the longer you run, yes, the more hydration you'll need and the more nutrients you'll need.
So is it preventing injury, preventing dehydration? They go hand in hand, and just knowing what you need to do to be...
Well, think about it, Jill. When an athlete is playing a sport, you see them on TV, basketball, hockey, soccer, and they're dehydrated, what happens? Have you seen an athlete get dehydrated? What happens to them? Think about it. They cramp up. You cramp up and you run on that, what happens to that muscle? It's going to get injured. So
Doctor.
you got to be hydrated to prevent injuries. It is that simple. I like keeping it simple.
Well, you are very complex in your simplicity, and we greatly appreciate the plethora of information as always. I'm Jill Lally with Dr. Donald DeFabio on the Natural Way to Better Health and Wellness. Thank you for joining us.